Hey, I'm Jeremy. I'm going to be your nurse today. I'm going to be doing a musculoskeletal assessment. You wash my hands first. And can you tell me your name and date of birth?
Anna Pratt, 3/12/98.
Okay, very good, perfect. I'm just going to ask you a few questions.
Okay.
Do you have any, currently have any muscle pain?
No.
What about any loss of movement or any inability to perform your ADLs, activities of daily living?
No.
Okay. What about any sports injuries?
No.
Okay. What about any loss of function without any pain?
No.
Okay. All right. Why don't you stand up for me? And I'm just going to have you walk a few steps over there and a few steps back. I'm going to be observing your gait for coordination, symmetry, and rhythm. All right. And everything appears to be coordinated and symmetrical with a good rhythm. I'm going to be checking your, you can just stay standing up. I'm going to actually turn this way. I'm sorry.
You're good.
And I'm going to be checking your spine for alignment and symmetry. Everything appears to be aligned and symmetrical, so we're good there. All right, and if you will turn back towards me, I'm going to be looking at your upper extremities for alignment, symmetry, and then I'm going to feel for any edema. So your upper extremities appear to be aligned, symmetrical, and I don't feel any edema. And now I'm going to, if you will pull your gown up just a little bit, I'm going to look at your lower extremities. Don't appear to be any, it appears to be aligned, symmetrical. Don't appear to be any edema. So we're good there. If you want to have a seat. All right, so now I'm going to check your, your face, head and neck area for symmetry and swelling. So I don't see any I don't see any asymmetry or any swelling, so we're good there. And I'm going to palpate for any heat or tenderness, okay? Any tenderness there?
No.
Okay, and no heat. Now, I'm going to do your thorax, so if you will pull your gown down just a little bit. I don't see any, appears to be symmetrical, no swelling, and symmetry, swelling, and now I'm going to palpate for any heat or tenderness, okay? And same on your back, very symmetrical, no swelling, any tenderness when I was hitting any of those places?
No.
Okay, very good. Now I'm going to check your abdomen. For symmetry and swelling, appears to be symmetrical, appears to be no swelling. Now I'm going to palpate for any heat, tenderness,
No tenderness.
no tenderness, and no heat, so we're good there. Now I am going to check your upper extremities, and I'm going to, I'm going to be checking your muscle grip and your muscle strength, and
You're
your
fine.
grip strength.
Okay.
So for your grip strength, I'm going to put my hands, if you will just wrap your hands around them, yep, and grip. All right, so that's a +5.
Okay.
And for your muscle strength, just put your arms up like this and try to pull your arms back towards you. Okay? And now try to push your arms out. Okay? Now do the same thing with your arms. Now try to push your arms down. Okay? Now try to push your arms up. Okay? +5 there as well. So we're good on that. And now I'm going to do the same on your lower extremities. So they appear to be, like I said, no asymmetry, no swelling. So we're going to test your muscle strength. I'm going to put my hands behind your legs, and I'm going to have you try to pull your legs in and then do the same thing, pushing your legs out, okay?
Okay.
All right, now try to push out. Okay, so we got a 5 there, so we're all good there. And so we're all good on your upper and lower extremities from that standpoint. Now I'm going to check your joints, okay? So I'm going to be checking all your joints, your major joints, for swelling, erythema, deformities, and then also your range of motion, okay? So first we'll start with your neck. So I'm going to, there's no swelling, no erythema, no deformities, and as far as your range of motion, I'm also gonna palpate for heat and tenderness.
Okay.
Sorry, not your, yeah. So any heat or tenderness?
No.
Okay. Now range of motion, if you will try to look to the sky and then look at the floor. Okay, now look to your left, look to your right. Okay, now try to put your ear to your shoulder. All right, so full range of motion on both sides there. Now we're gonna look at your shoulders. So I'll pull it down just a tad.
Okay.
And I'm gonna have you shrug your shoulders. Okay, and can you pull your, bring your hands up like this, and then back in front, and across your body, perfect. All right, and I'm gonna palpate your shoulders, no heat, no tenderness, no swelling, no erythema, no deformities in your shoulders. So let's do the same thing with your elbows.
Okay.
Elbows, both sides, no swelling, no erythema, no deformities. Now let's check your range of motion. So just try to do this for me, okay? All right, so full range of motion in your elbows, very good. All right, now let's check your wrists. No swelling, no erythema, no deformities. Now let's check your range of motion. So if you can just put your hands out like this and then try to go up and down. Okay, very good. All right, now let's check your fingers. We're going to be checking for any swelling, erythema, deformities. Don't see any there. Did you break this finger?
I did.
You did, okay. All right, so we do have a small deformity there in your left pinky finger. And let's do your range of motion. So what I'm going to do is just kind of see what I do and just follow it, okay? So just kind of extend your fingers out like that, close and grip a fist, move your thumbs in and out, perfect. Now open your hands and see if you can put your thumb to each finger. Okay, very good, perfect. So we have full range of motion there. All right, now I'm going to do your knees. So we have no swelling, no erythema, no deformities. For range of motion on your knees, if you can just extend your knee and then flex it backwards, okay? Do it on, yeah, there you go, both sides, all right? And like I said, no swelling, no erythema, no deformities there. All right, now we're gonna do your feet, your toes. So same thing there, let's see. If you can take your socks off just for me for a second. I'm gonna be looking, okay, so no swelling, no erythema, no deformities. And for your range of motion, if you can pull your foot up towards your knee on both sides and then push it down like to the floor, there you go. And if you can push both your feet out, there you go, and then invert it, push it in, perfect. Okay, so we have full range of motion in your feet. Now we're gonna, if you will stand up, I'm gonna check your spine. So no swelling, no erythema, no deformities, range of motion. If you will lean down, lean over, okay, and stand back up, okay. So you have full range of motion in your spine. Now I'm gonna check your hips. Yeah, that's perfect, there you go. Let's see. All right, so it appears to be no swelling, no erythema, no deformities. And we're gonna need to check your range of motion on your hips, okay? So I'm gonna have you lean over to one side and then lean over to the other side, okay? All right, and I think that's gonna do it. I'm gonna do a fall risk assessment for you, so you can sit back down. All right, So I'm just going to go through a couple things, and this just tells you if you're what your fall risk may be, if you're significant or not significant.
Okay.
So no confusion, disorientation, or impulsivity. Do you have any symptoms of depression?
No.
What about any altered elimination with urination or anything? Okay.
No.
Any dizziness or vertigo?
No.
Okay. Gender, you're a female, so
Mhm.
have you had any anti-epileptics or anticonvulsants?
No.
Any benzodiazepines?
No.
Okay. You will hop over in this chair for me briefly. And then I'm just going to have you stand up like you're kind of getting up and going. Okay, very good. So you did that with no issues. You didn't have to push up. You didn't need multiple attempts or anything like that. You were able to rise without any assistance. So that brings your score to a total of 0, which means you have a very low risk of fall.
Okay.
Now, if you did have a fall risk, I would say that we would want to make sure you have some non-skid socks, rails up on your bed, call light within reach, probably a notification of like a bracelet on you to let other people know, that sort of thing. And then that would be here in the hospital. At your home, it would be not having rugs that aren't basically not necessarily nailed down, but on the floor real well, handrails, those types of things that can just make sure to keep you on your toes. So that concludes that. I'm going to wash my hands and I'm done.